Hello, everyone. Welcome to this session of the Preventive Care webinar. I'm sure you have expected this for a long time, and now we are back. We are back to keep educating you on your health, how to avoid illnesses, more than just treating illnesses. We are not here to, let you be the one to treat illnesses when it comes. We are here to help you to understand how to handle illnesses, prevent illnesses even before they come. Prevention, as they say, is better than cure. So, in today's session, we are going to be learning about women's health, and this is a very interesting topic. Um, Subject of study that has been shrouded by a lot of mystery, sometimes even shame, that people are not allowed to talk about their health, especially women. They are mostly not allowed to share certain things. Some of them are ashamed of sharing certain things. But today, this is a safe zone. We're going to be talking about women's health, particularly with a focus on preventive health care for women. And of course, we have an amazing guest who is going to be teaching us today. I'm going to be bringing her up in a moment. And while you anticipate that, let me set the tone one more time to welcome you once again to the Preventive Care webinar. You know how it goes. The Preventive Care webinar is presented to you by Lawson Healthcare, and at this webinar, we invite different healthcare professionals, from doctors to dentists to fitness coaches to different healthcare professionals, to teach you how to stay on top of your game when it comes to health. If you follow Lawson Preventive Care series, you can be sure to learn the things that will help you stay on top of your game all the time when it comes to health. You are staying a step further, a step higher than diseases. That is what you gain from joining our preventive care webinars. Whichever series we are having, whether we're having a series on women's health or sexual health like we did the last time, or your dental health, everything is geared toward helping you to master your health and be that person that stays one step ahead of the game, and be that person that illness doesn't catch up with. So welcome once again. Take the link that brought you here, send it out, put it out there. Invite your friends, invite your enemies, invite your exes, invite your village people, gather everybody, let them learn about their health. All right, I'm going to give you 1 minute to do that. Invite everybody, take the link that brought you here, put it out there, invite them, tell them this is for their health. Every woman in your life, whether she's your mother, your sister, your girlfriend, your neighbors, get everybody in, let them join in and learn about their health. Okay, so um, we have an amazing guest here with me today who is going to be teaching us on women's health essentials. And for too long, just like I said earlier, women's health is something that people treat with a lot of shame. They don't want to talk about it, but then today we're going to be delving really deep into it, unveiling all the things you need to know, the myths that people believe that are not necessarily true, and we're going to be looking at everything. And I promise you that by the end of this session, you're going to be going out with a surefire way of having a handle on your health as a woman. You will know what to do, you will have the right information, and you'll be able to make the proper decisions as someone who is health conscious. And that is not all. At the end of this session, if you stay till the end, you are going to be getting the preventive care ebook that was just recently released, that will help you organize your health and stay on top of your game when it comes to health. So, our guest today is an amazing individual. She's going to be talking to us for the next 40 minutes. So I'm going to quickly introduce her. Her name is Juliet Obasi. Juliet Chinasa Obasi, and she's a women's health advocate and a licensed medical laboratory scientist. She helps women write their health stories, and achieve 360 health success. Over the years, she actually struggled with hormonal imbalance and irregular periods, and she found out that there's a lot that needs to be done when it comes to women's health, because when she was struggling, there was a lot of misinformation. There was a lot she had to deal with, and she decided, well, I'm not going to allow other people deal with this. So she recently launched an academy called the Every Woman Bootcamp, where she teaches women about their health, and where women feel supported, understood, and confident in their health journey from their first period to motherhood and beyond. Through education, community awareness, and holistic wellness strategies, she advocates for women's health and has helped a lot of people rewrite their health narratives. She has come today to equip women and everyone else here with the knowledge to thrive physically, emotionally, and health wise. So, as you put your fire emojis and clapping emojis in the comment section, please help me welcome our guest for today, Juliet Obasi Chinasa. Put your hands together for her in the comment section. Put your hands together for her as I bring her on. All right, the floor is yours, and I give it up away to you.
All right. Good evening, everyone. Good evening. Can you hear me, Sir Prosper?
Yes, I can hear you. I can hear you loud and clear. You
Good
can just
evening,
speak
everyone.
up a
I don't know
little
if
bit.
anyone can hear me. Can you hear me?
Yes, we can hear you. We can hear you. I can hear you from this end.
Hello, good evening, everyone.
I can hear you from this end. Just go ahead. Are you with me? I can hear you. Go ahead.
Okay, you can hear me, right? You can hear me. You can hear me now.
Yes, I can hear you. Go ahead.
Okay, let me just, though he has done the whole thing, he has done a perfect introduction. That's just me, but let me just still add a brief introduction about myself. Okay, my name is Juliet Chinasobasi, a licensed medical laboratory scientist and a women's health advocate. I'm a woman that is very passionate about women's health. I'm so about it. I'm a woman. Like, can you hear me? Like, whenever I hear some ladies say that they don't love the fact that they are women, I'm always amazed. I love being a woman. Like, even in my next world, I would still want to be a woman. So, though it has not really been easy being a growing up as a lady, like he said, just starting from the first day I saw my period, like it has been hell. Like it has not really been funny. It started with pains. Then I think after the first time I saw it, I didn't see it for the next 6 months, and that was how it continued. It comes with pains. It comes with so many things. It's sometimes there was a time it was so irregular. So I think it was just all these things that pushed me into women's health. Into it was all these pains and struggles with my health that really pushed me into getting to know more about women, because I noticed that less attention is paid to women's health, and we really need all this information to get it right, to get it better in this journey. And that was just what pushed me. And I must say, I am very much honored to be speaking to you guys this evening. Like it is a privilege, it is an honor to be invited to this webinar this evening. I'm so honored. And let me not talk so much about. Let me just delve right into what we have for the day. I'm sure some of you must have been hearing prevention is better than cure, all these our normal sayings, but we just like see it as a normal saying. We don't really like think deeply or meditate on those words. Prevention is better than cure. Preventive health is usually neglected. People don't really pay attention to their health or until there is maybe a significant symptom that they see. But some of these things are things that could have been prevented even before those things stirs up in our lives. Hope you guys can still hear me. Please, you guys should drop comments. Let me be sure I'm not talking to myself. Let me be sure I'm not talking to myself. So, preventive health, like, it's just like a woman that is pregnant. She'll be dodging. Some people even dodge antenatal sessions. Then maybe she'll keep dodging those antenatal sessions till get to her third trimester, and she will not know that the baby is in a breech position, which could have been addressed during her antenatal sessions. So this is what we teach in preventive health care. All those things you need to do to prevent maybe lifelong diseases, lifelong symptoms that could have altered maybe your future. It's all these little things you do now that can help you prevent them, like vaccination, some certain lifestyles that you need to adopt. All these things will help you to navigate through it in the future. Okay, I want to start by telling you the importance of the importance of preventive health care. The first one is that it helps to save lives. It helps to save lives. So many people die out there due to little things like HPV, human papilloma virus, that could be prevented with just vaccine. And vaccine is something that is free. I don't think I've heard that someone paid money to get vaccinated in a hospital. I don't think I've ever heard of it. Vaccines are things you receive for free, but if not done at the right time and maybe the normal dosage taken rightly, cervical cancer could surface later in your life and lead you to your early grave. So these are all the things I would like to talk about today. That's the first importance of preventive care, preventive health care. Then the second one is that it reduces healthcare costs. You know what sick people are paying in the hospital just to stay alive? I don't know. I think there was a content that was circulating how much is oxygen for breathe it for free, and we don't really know the cost. If you see the amount of money that sickness makes people to spend at the hospital, you will take today very serious. Little things like taking enough water for the day are things that can help you to prolong your life and your future. And another thing about preventive health is that it helps to prevent so many diseases like lifestyle counseling. Okay, you know that in your family, your grandfather, your grandmother died probably due to diabetes. Nobody needs to tell you. Nobody needs to tell you to improve the way you live your life, to know the way you deal with sugar and other things. It's left for you to take that decision. So all these basic counselings are what helps you to stay in track, to prevent those things that could alter some things in the future. Okay, let me start by educating us on the key pillars of women's preventive health. There are the ones that is generally for everyone, and there are the ones that you need to get to a certain age before you can do. There is a regular checkup that is not optional. It's basically for every woman. As far as you're already a lady and you become an adolescent, you've developed breasts, other things that makes you a woman. This one is for everyone. This test is what we call the well woman visit. This one is just a test that you will schedule an appointment with a gynecologist, one-on-one appointment. And this one, you don't need you hide anything. If there is anything maybe you've already seen that is happening in your body that is unusual, you talk to your gynecologist about it. You're not hiding anything here. You guys will talk about future screenings like HPV. HPV is not done during your adolescent age. You do it later in your life from it's usually recommended around 40 or 50. So these ones, you don't need to do anything, just to screen for the basic things you need to know about your health. Maybe to be sure, I think I did it around when I was 16. They screened and checked the size of my uterus, though then I've started menstruating and all of that. They were basically screening to check the size of my uterus and co to be sure everything is intact. So this one is the one that is open for everyone. as far as you're an adolescent and you've developed things that makes you a woman, you're no longer a kid. So this one is open for everyone. Then the second one is pap smear and HPV screening. This one is the one you need to do. This one you can take vaccinations. Vaccines are open for HPV. It is something that can be prevented. And I think it's the booster is usually taken. It's a lifetime attenuated vaccine, so you don't need to keep taking it and taking it and taking it. It's something that you just take that will last for a lifetime. Please drop comment. Talking to myself right here. Can someone just Saprosper, please drop comment abeg, let me be sure you guys can still hear me. So this one is a type of vaccine you take. Is a life attenuated something. So I think it's like 2 or 3 boosters that you need to take that will sustain you for life. Then if the thing has already occurred, if you've already been diagnosed with HPV, I think it's something that resolves on its own. Though in some cases it doesn't resolve. Some cases it doesn't resolve. But if you're up to 18, if you're up to 40, I think that's when it is recommended. If you're up to 40, you go and screen for HPV. Then from 18 upwards, you can take vaccines for HPV, human papilloma virus. Then another thing is mammogram. This one is not recommended for any age. Okay, this one is okay. Breast this thing examination is not for any age, but mammogram, which is an X-ray for breast to check for breast cancer, is recommended for women from 40 upwards. But if you are below 40, if you are maybe from 18 upwards, you can just be doing your regular check. Probably when you want to take your bath, you check your breast, you check for lumps, you check for breast pain. Yes, that's another signal of breast. That's another symptom which could be a sign of breast cancer. You check all these things. Don't neglect any unusual pain on your breast. You check and be sure that it's normal. You talk to your gynecologist. Pain, check for lumps, anyone. You just go and you confirm whether it is a benign lump or a malignant one, because it is all these things that be. And if at that initial stage that it hasn't spread, it really helps. So that's just the first things I need to say. Sir Prosper, can you still hear me? Please drop a comment. Let me be sure that I'm speaking to someone here.
All right, I can hear you. I'm with you. Once you need your slides, I will begin to pull
Sir
them up.
Prosper,
I can hear you.
slides now. Let me start using the slides. Move to the
Oh,
second slide. Can you hear me? Hello? Eh. Okay, let me just start slides. Okay, to do in your preventive healthcare journeys, listening to your body. Any unusual change at all, even if it is the color of your urine. Probably your urine has been in this color and you now notice there is no longer that color and you are taking enough water, because sometimes it could be dehydration, maybe not taking enough water that could change those things. But as far as, please, can you make this okay, I think I can see it now. Listening to your body for any signs, checking your breast like I said, for lumps or pain, any form of pain at all, as far as it's not normal, as far as it's unusual. Though I notice that during period, I think I usually have that. So I don't know. I think it's a normal something. But after your period, if you are still noticing any kind of pain on your breast, it is a thing to be concerned about. Then please move to the next slide. Give me the next slide. Can you hear me? Okay. Okay. I want to talk about some things that you if you notice in your body, there are some signals you shouldn't ignore, like severe cramps, dysmenorrhea, severe cramps is not something to ignore. Severe cramps could be a cause of like it could be caused by an underlying health issue like endometriosis, ovarian cyst, PCOS. I know most times periods comes with little and mild to moderate cramps, but anyone that is not normal. There was a day I went to see a friend and she was rolling on the floor because of her period, and I was like, no, 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 no. This is not supposed to be so. This is not normal. So any type of severe cramp at all that is not normal, please don't keep quiet about it. And be sure that you're not consuming a lot of sugar, because I noticed that excessive sugar and soda consumption is another problem when it comes to cramps. Don't consume too much sugar. Your body doesn't really need all those things. All this processed food. I will always advise women, all this processed food is not really good for us. Then pain during sex. Pain during sex is not something to be ignored, especially if you are no longer a virgin. Because I noticed though some virgins, it's not really because they started having sex that is causing all these things. Sometimes it's because of their mindset towards sex that makes them to feel a whole lot of pain during sex. So as far as you have an open mindset towards sex, even if you're a virgin and you are still experiencing pain, it could be a sign of an infection. So these are the things you shouldn't neglect. So immediately you start experiencing any kind of pain during sex, you go and meet your doctor and talk to your doctor about it. Then another one is chronic pelvic pain. Chronic pelvic pain should not be neglected. It shouldn't be neglected at all. It could be a sign of maybe PCOS, PID, pelvic inflammatory disease. Pelvic inflammatory disease. Then heavy flow. Heavy flow is another thing. There was a period I was experiencing a whole lot of things in my body. I was having a very strong heavy flow. My period, I will be seeing my period for 1 month. Like I just kept quiet. Okay, then I was still in secondary school. I was still in secondary school, and then I just carried myself. I didn't even tell my mom. I was losing so much things from your body. It is not normal. You are supposed to go to the hospital. Like I said earlier, you talk to your gynecologist. Some series of tests to be performed to prevent a whole lot of things. If it is PCO, if you work on your diet and some of your lifestyle during your PCO will not get PCOD will not get to PCOS. It will reverse back. Then another thing is bleeding between periods. Some people they will see their period today, then tomorrow they will not even see it at all again. It will come next tomorrow. It is not normal. And the last one is postmenopausal bleeding. After menopause, I'm talking these ones is for those that have, that stopped seeing their period and they are now maybe probably around 40, 45 or thereabouts, and they are still bleeding. You are meant to speak to your doctor. Then hormonal shifts. Overly overweight, it might lead to insulin resistance. So when you start noticing unusual weight changes, today you gain 2 kg, next tomorrow you lose it, and you are not you are not losing weight again. You are gaining weight again. Medical provider. And then when you start experiencing severe cramps, Then excessive hair growth. When we were growing up, if you see all those women that have hairs on their chin, you be laughing. My mom then she would tell me that they are wicked, that's why they have hairs on their chin. All those times we didn't know it was PCOS. So if you're experiencing excessive hair growth or hair loss, talk to your doctor and confirm that it's not PCOS. So that if it is PCOS, you start treating it ahead of time. Then another thing is energy and mood. Could be an underlying neglect. Then unusual vaginal discharge. If you don't have any infection, there are some discharges that you will see that you know that is not normal. Then persistent itching is not normal. If you shouldn't mind, me, the place I'm staying is not really. So that's it. There are some unusual things you should see in your health that you shouldn't neglect. Then please can you give me the next slide? Please can you give me the next slide? Sir Prosper, please give me the next slide. All right. Okay. These are some of the facts and myths we've heard long time ago. Long time when I was in secondary school, there was something they were always saying that if you're always having painful period, that if you have sex, it will stop. That one is a very big lie. It's not going to stop. It's not going to stop. Cramps could be caused by so many things, and I can tell you, even if you like, have sex from now till tomorrow. If you don't treat the underlying cause, it will still be there. So some of them is that periods are supposed to be painful. It is a lie. It is normal to have maybe moderate or mild cramps. Moderate, it is now so extreme. It's not normal. They're always very small, but with time they develop and become very big and could be a problem, probably during childbirth, or it could even at times it could lead to infertility. Then another one is that you can't get pregnant during your period. This one is a very big lie, especially for those that have very short menstrual cycle. You can get, yeah, in fact, if you have short menstrual cycle, most times that's why some people are still that are calling themselves TTC moms. They've not even maybe tracked the problem. They've not really tracked the problem to know what the problem is really is. Some TTC moms have very short ovulation menstrual cycle, and they are meant to have sex and they ovulate during their period. So having sex during your period helps you to conceive, especially if you have very short menstrual cycle. Then another this thing is vaginas need special cleansers. Or this one is the worst one I've ever seen. The vagina is self-cleansing. God created it in a way that it cleanses itself. So you don't need any special something. You don't need any special something to clean your vagina. You basically need just water. Even the vulva, the outer parts, you don't need any soap. Even if you must use soap, which is still, to me, is still not advisable, you just use a very mild soap. Use a very mild soap. But though it's self-cleansing. Then another one is that breast cancer doesn't affect young women. It is a lie. It affects basically everybody. So immediately you start developing breast as a lady, be checking your breast constantly. Be checking it constantly. Be checking it constantly. Be checking it constantly. Then if you are of age, from 4 H2A to be sure. So that's it for the facts and the mites you've heard of the years. Sir Prosper, the next slide. Oh, I think I'm not really fast. My time is almost up. The next slide. All right, thank you so much. Okay, let me just. This one is about the little little things, the little little prevention toolkits you need for some of your health these things. Okay, the first one is urinary tract infection, then yeast infection, and bacterial vaginosis. To prevent them, number one is to drink plenty of water daily. You normally as a woman, you know that 70% of your body organs works with water. I always put it on my page almost every morning that the first thing you should do in the morning is to take a glass of water. Water is very, very essential for basically every body activity. Is it digestion? Is it digestion? There is basically nothing that your body is doing that is digesting. It needs water. It needs water so much. So infections like urinary tract infection and yeast and bacterial vaginosis, you need to keep drinking a lot of water. Then always pee after sex. This one is very, very necessary, especially when you have multiple sex partners. Always pee after sex, especially those with multiple sex partners. Then even if you have one partner, be sure of your partner once in a while. You should go to the hospital and go for screening. Then always pee whenever you. Then another one is you should go for breathable underwears. Stop. I don't know if you are here and you still use scented pants. All these pants that they scent, even pads, is not healthy for your vagina. Most of these things you go and cause irritation in your vagina, and sometimes you to go and alter your vagina pH. So it is not very healthy for you. Go for unscented ones. Opt for unscented ones. Then for the pants, go for cotton pants. Go for cotton pants. That's the best. Then the next one for cervical health. Okay, for cervical health. This is the easiest one to do. Vaccine. If you are not vaccinated and you are still here, please go and get vaccinated against HPV, human papilloma virus. I know sometimes it comes and resolves, but this vaccine is something that will help you, that will prevent it for a lifetime. It will help to prevent it for a very long time. Hope you guys can still hear me. Sir Prosper, please, can you drop a comment, please? Let me be sure I'm not talking to myself. Okay. Then also go for regular pap smears to an HPV test, especially if you are of age. If you are of age, go for HPV test regularly. Then when you are young, take the vaccine. Then for your breast, always perform a regular breast checkup. And if you are married, your partner can even help you. Your partner can always help you to go about it. Your partner can always help you if you are still single like me. Or if you are bathing or something like that, just go around it. And the best time to even check it, I think it is during or maybe after your period. Yes, I think it's after your period. Yeah, you check your breast and be sure. Check if there's any unusual pain. Because nowadays some just giving you signs. So any is something to be concerned about. Then okay, for your general this thing, for your general wellness, general prevent, this one is the one that will help you no matter it will still help you. This one is to maintain a balanced diet. I will always say, you see processed food there, they are one of the worst things you should be consuming. You see all this indomie, shawarma, wey dey kill us. Shawarma, pizza, oh god, please go natural, go for organic meals, vegetable, healthy fats like avocado, like it shouldn't be missing in your diet. healthy fats, avocado, proteins, eggs, fish, salmon fish. It is very, very healthy for a lady, not just for your reproductive health. It is very healthy for your general well-being. Protein, you do so many things during the day, so many tissues worn out during the day. You need proteins, especially in your diet, to replenish those things. And you need fruits too, though you don't really need so much fruits. You just need it in a normal quantity, because vitamins and minerals is just something you need in a little quantity daily. It's not something to be taken in a large amount. Then another thing is always engage in a regular exercise. Don't overdo it. I always tell people, don't overdo it. Don't overdo it. You can just take a walk around your this thing, around your compound. You don't need to overdo it. Taking a walk, be jogging, skipping, but don't always overdo it. Then another one is practice stress management techniques like meditation. I do this one a lot. When anytime my head is full like this, I'll just sit down at the corner and meditate. I do this one very well. You can practice yoga too. It really helps. In fact, yoga helps in preventing cramps. So these are the two things: meditation, yoga. They really help. Then the last but not the least, ensure you always get quality sleep. 7 to 9 hours. I know, hey, this one they will be like it's only lazy people that should sleep up to that amount on there, but you need sleep. You need sleep to even prepare for the next day. You need sleep in everything that you do. Sleep well. It is when you sleep well that your body will rest and prepare for the next day. You cannot finish everything you want to do in a day. You can't, no matter what you do. Tomorrow you still have something else to do. So just do the little you can always do in a day and move to the next. Oh, thank you so much. Okay, when to seek for help and essential tests to do. There are some times that all those symptoms, you should seek for help. You shouldn't just neglect them. The first one is persistent symptoms. Like I will talk about this breast pain and lungs. You've been having breast pain. Normally, you don't usually experience so much pain, and just recently, you start experiencing so much pain on your breast. Please don't keep quiet. Severe cramps. Don't keep quiet. Talk to your doctor. Talk to your nurse. Talk to your mom. Talk to your husband if you are married. You people should not shut up about it. It is all these things that helps to prevent maybe the thing being drastic. Like a little lump in your breast that you notice, if it is removed early, it could prevent maybe them cutting your breast later. So that's the first one. Then go for routine checkups. Schedule regular checkups. Even if you are fine, because sometimes you think you are fine, but deep inside you are not even fine. Sometimes you think you are okay. That's why some people will be walking on the road and they will just fall because you think you are fine, but that you are not fine. Then possible tests to discuss with your doctor. Blood tests. This one, don't play with it at all. You see, blood test. Blood test can help you to diagnose things that you don't even know that are underlying in your system. So some of the blood tests you can go for is full blood count, thyroid function, PCOS panel, and then prolactin. These are the things to discuss with your doctor. Then for your reproductive health, pap smear and HPV test, fertility concerns and STI screening. These ones you do it urine or swab or HVS, high vaginal swab. These are the ones you basically use for like pap smear is HV high vaginal swab that you use. So for breast screening, this one is if you are both 40. Please, I don't think this mammogram is extreme. I don't think it's basically for older women. If you are still young, just be doing your normal regular regular breast checks. You don't need to go for a mammogram. So that's it. This is when you seek help. The next slide, please. Okay. I think this is the this This is like an empowerment. This is like an empowerment for this program. Be your own advocate. Learn to track your cycle. You cannot be, I don't know how, okay, I think this program is for from 18 and above. You cannot be seeing your period from, some people start seeing their period around 9, 10, 12. You cannot tell me you've been seeing your period from now, from 12 till 20, 30, 35, and you are not tracking it. Though I know some women find it difficult, especially if you usually have irregular period, but still track it. There are some apps you can use to track it if you cannot track it on your own. You can use Flow app. Like me, I use Flow app. That's the app I use. Use it to track your cycle. Use it to track your ovulation. Even if you are still single, if you get married, it's going to help you to conceive easily because you will know when you are ovulating. So that's it. Then the next one is, and always ahead, confidently speak to your doctor during appointments. It's not when you go to the hospital, oh, like something is wrong with you, you still go to the hospital and you go and be lying to the doctor. You don't hide anything from your doctor. It is your doctor that will help you. So why hide things from him or her? Tell the person everything. Tell the person everything that they need to know. So the next one is prioritize preventive visits ahead. Schedule. You can choose. If you are still young, and I know you might not maybe afford it or something like that, you can be doing it every 2 or 3 years. Schedule visits. You don't need to be sick before you go and see a doctor to be sure that everything is intact. Schedule visits. Go once in a while. Go once in a while to be sure that everything is okay in your body. Then another one is build a trusted healthcare team. Yes, find a doctor friend. Have a doctor friend that you can always reach out to. Okay, look at what I noticed too. I noticed that this one is now doing me. My breast is this. This type of discharge is coming out from my body. Doctor, is it normal? So find a doctor friend. Find someone you can rely on, that you can always speak to, that you are free with. Then the last one is follow certified medical professionals and reputable organizations for accurate guide. This one is, people you can follow online, people that give accurate information. Oh, it's not those that just post things. Chat GPT is now everywhere. You can just use it, go and copy it and come and paste. Anybody you are following, make sure the person knows what they are teaching. It's not the one they will teach. Drink onions, drink this. You end up on the hospital bed. Any health professional you are following, make sure the person knows what they are doing so that you know get the wrong information. So that's it for this. The next slide, please. All right, okay. Beyond the basics, beyond these things we are talking about, okay, I just wanted to share something about PCOS and thyroid disorder. These things, most times they are kind of, the symptoms tend to look alike and people mistake it for the other one, but they are not really the same. They are not really the same. Yeah, they have minor differences, though they kind of sometimes show some little distance, but they are not really the same. Like for PCOS, the symptoms sometimes would be excessive hair growth, especially on the chin, on your chest area, then severe acne and irregular period. This one is basically for PCOS, and most times PCOS can be managed by a dietitian. With a good diet, exercise, it can be managed. Then for the thyroid, this one is usually characterized with fatigue, weight fluctuations, and mood changes. So this is just the minor, and hair loss. The other one, PCOS. If you've seen all these women with hair, they are on this PCOS, but you see thyroid is characterized with hair loss. So that's the minor difference between them. The little difference between them is not that much, but just know the difference. Okay. This, we are gradually getting to the end. This is just the basic things you need to do, like for your breast, regular checks. Always check your breast regularly. You can even do it at least once every week. Do it. Then, no, no little things that happens in your body, any little change at all. No. Then for older women, I've said it earlier, mammograms are highly recommended. Go for x-rays, check your breast so that if anything is detected, it could be removed early. If it is just a lump, two lumps, it could be removed and your breast will still be intact. But if you keep quiet and you don't check all these things, it will lead to the permanent this thing. So that's the thing. Then for cervical health, pap smear, kind vaginal swab once in a while, go and do it. HPV, go and do it. Then get vaccinated if you're not vaccinated till now. Get vaccinated. Go and take your vaccine. I don't know why people don't like taking vaccines. Like it is one of the best ways to prevent so many things. Because I know there was a time this okay, things like chicken pox. Chicken pox is something that if you vaccinate and it does you once in your life, you don't need to get the vaccination again. Like that's the end of you not experience chicken pox again. So all these little things that you can easily prevent. So just go about it, go and do it. All this vaccination is something that gives you a lifelong this thing. Okay, so let me just conclude. Like, thank you all for this. Thank you all. So, in summary, I think I've said everything I need to say here. Just is basically your reproductive health. That is one of the most the cases women usually have problem. So any unusual discharge, don't neglect it. Any unusual pain on your breast or anything, don't neglect it. Then for older women, go for regular testing, uh, bone screening to check for arthritis. Go for this thing. So I believe we've all learned one or two things from here. I believe, and I am so glad to be here. So thank you all for making our time to join us today. Thank you for thank you for bringing out and thank you, Sir Prosper. So I'll be awaiting. If you have any question, you can drop it now. You can drop it now in the comments, or you can.
All right, all right. That was an amazing, amazing session. You've taught us a lot in a very short time, and a lot of questions are already coming in. So this is me and the entire Lawson Health community saying a very big thank you to you, Juliet, for taking out the time to be present here and teaching us on these very crucial things. I've personally learned a lot, and I believe our audience have, learned a lot too. So thank you so, so much for being on here with us.
Yeah, you're welcome.
All right,
And I'm
so
so
there are
sorry
many.
for the instructions.
It's okay. It's okay. So there are a couple of questions in the comment sections and from the group already. I'm going to be putting them on the screen and reading them out so that you can react to them, and then we can call
All
it a
right.
wrap for the day. So everyone else, if you
All
have any questions, please put it in the comment section or send it to my DM on WhatsApp if you have my WhatsApp line, or just put it on the group where you registered, and then the question is going to be answered here. So the first question is this. I think this question was asked when you were talking about checking the breast, examining it. So this person asked, how can we check the breast?
all right. All right. How to the best? Okay, let me start from the best time to check. The best time to check your breast, I think, is after your period. Yes, 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 yes. It should be after your period. You lie down. You lie down. You check. You check from the uh you check from the up. You just be touching it and be feeling it. You be feeling your breast. You check the down part up to the this thing. Then you check the body of your breast to be sure there is no lump and there is no pain. Hope you can hear me.
Yes, we can hear you. We can hear
Can
you.
you
Go
guys
ahead.
hear me? All right. You check it from the should I call it the V line? Yes. You feel it. You touch it with your hand. Touch it very well. And be feeling it to be sure that there is no lump at all. Though sometimes some people have lumps and those lumps can be benign, like it's not cancerous. If you are feeling anything at all, go and meet your doctor. Don't hold. If you keep hiding it, that's when it might develop to something bigger. So you start from the V line, you check it, just check it from the V line. touching it and be sure that there's no unusual, there's no lump. That's how to check your breast. As you're checking, breast examination, or you can still reach out to me in my DM if you need maybe a video or something on how to go about
Yeah. Okay. All right. I think she did justice to the question. Um, she has done justice to the question. The next question is coming from someone else. The person is asking, what is PCO? I think you talked about it during your session. PCO and PCOS. Uh, she, I think this person is asking, what is PCO and PCOS? And then what is the difference? What is the difference? I think for a moment your network went out. Let me try adding you again so that you can answer this question.
Can you guys hear me now?
Yes, I can hear you. I think your network went out shortly.
Yes, network. Okay, I'm seeing the next question. What is PCO and PCOS, ma? What's the difference? Okay, let me just say PCO and PCO is just like HIV and then AIDS. PCO is like the initial this thing when it starts, when it has not become so severe. It can still be managed if it is managed properly when it is still at this stage. It will not get to this stage, which is PCOS. And that's the more reason we are teaching about this preventive health care. If you just notice anything, the PCO is like the initial stage, just like HIV is the initial distant stage of AIDS. If managed properly, now that they are antiretroviral drugs, if managed properly, so it gradually gets to AIDS. So the PCO is the initial stage. If it is managed properly, immediately you start noticing those symptoms and you speak with your gynecologist and you start managing it, it will not get to the PCOS, which is the main syndrome, which is the state in which you already have the full blown PCOS. So that's basically the difference. Hope you are cleared. Sir Prosper, can you hear
Yeah.
me?
Yes, I can hear you. I think we are clear on that. I'm going to be uploading another question from the group. Someone sent this on the group, so I'm putting it here.
All right. How do I
Can you see
convince
the
my
question?
Yes, I can say how do I convince my friends who think vaccines are dangerous? This one this one is not even a some people are like that too. Like I even have people around me like this. There are some people that think that they want to inject diseases into their body. It's just like some people that think that maybe family planning that they want to kill them or they want to remove their wombs. This one is just you keep talking to them, you keep preaching, trying to convince them that you tell them what vaccines are. You tell them that vaccines, you explain it to them. Okay, let me just quickly say something about vaccine. You can tell them that vaccines is just like that disease that might kill you later in life. They will introduce it to your body so that your antibodies will fight it and get used to it, so that later in your life when that the bigger one comes, it can just tackle it the way it tackled the initial stage. You just keep talking to them, just keep teaching them and educating them that is not harmful to their health, that is, it is a way of protecting them. It is a way of protecting them. So that's just what you keep doing. There's nothing more you can do. You just keep educating them, telling them the importance that it helps to prevent long time diseases that can occur later in the future. It helps to save their lives, because sometimes if you are vaccinated against something, later when that thing shows, it might be happening to everyone around you, but you go just jump and pass. So just keep educating them. I think that's all for this question. I think I've
All right,
like
all right. Thank you for handling that question very well. And I think this is the last question before we wrap it up and call it a day. Someone put in the group, do you have any resources for my young girls to learn about women's health?
I do. You can follow me on my page. My Facebook is Facebook. I'm very active now. I'm not active on other platforms. You can follow me on my page. And like Sir Prosper said, I'm currently I currently launched my boot camp that will be starting on the 1st of October. You can join, though it's not free. It's not free. I won't lie to you, it's not free. I though once in a while I do free ones, but this particular boot camp is not free. Though I brought down the price recently, it's 5,000 naira, and it will be happening twice in a week. Then during the week, we take care of the questions. So you can pay and join. You can pay for someone. So that's just my resources for now. Either you follow me on my page, you learn for free. I teach for free there. But if you want something personal, you join my boot camp that is coming up next month, or you pay for consultation. I'll
All
recommend
right, all
materials
right.
for you.
All right. Thank you so much. Thank you so much, Juliet, for being on here with us. Before we wrap it up and
Yeah.
call it a day, I'd like you to share your social media handles so that I will just put them up. So on Facebook, it is Juliet Chinas Albasi, right?
Yes. So you can just help me and share it. That's just my only active this thing for now.
Okay, I'm putting it up on the screen right about now. So if you want to, you all should follow her on Facebook. That's her handle there. It's correct, right?
Yes, sir, it's correct.
Okay, so that is our social media handle. So this conversation is going to continue in the platform where all of you registered. Um, Thank you for being part of this edition of Preventive Care webinar. It has been an amazing session so far with Juliet, demystifying a lot of things. I personally learned a lot and I enjoyed myself thoroughly in this session. Thank you for being on here with us. It was a long plan. There's so many things we had to shift heaven and earth to make this happen, and it is done now. Thank you so much for being on here. We are just a few seconds over 1 hour, and we should be wrapping up now. And then to the audience, everyone that showed up, thank you so much. Go ahead and follow Juliet on her Facebook platform. Follow Lawson Health to keep tabs with us. We do this every single month, and we invite different people to come and share on health. Imagine you learning this every month. Every month you are learning from a different health professional completely for free. Imagine in a few months' time how knowledgeable you will be, how healthier you will be. You will be much more than the average individual out there. So thank you once again for being on here. Um, Till next month, until our next edition, we'll see you. For now, watch these videos and follow our guests and the Lawson Health page on Facebook. Thank you for being on here. God bless. Peace.